I'm referring to agenda item number 5, which is the action plan for the prevention of non-communicable diseases. It is a gratifying sign of the progress achieved over the years in the health profile of many nations that non-communicable diseases have come to be recognized as a health priority. This change comes at a time when the health systems in Europe and globally are being reviewed to attain sustainable development goals, and that these conditions are emphasized in the resolutions of the United Nations Assembly. Emphasis has been given to certain categories of conditions like cardiovascular diseases, diabetes, cancer, chronic respiratory diseases, and obesity. Even though it is recognized that children can die from treatable conditions other than the above, the whole policy revolves around adult conditions and not to pediatric conditions like hereditary conditions. And the Thalassemia International Federation represents a group of chronic hereditary disorders of the hemoglobin molecule, which are the commonest, perhaps, of the serious hereditary disorders. Our intervention aims to emphasize the need for a closer look at these conditions and consider a separate approach in planning health services from the strategies and plans under discussion in this consultation. Concerning the hemoglobin disorders, it must be noted that they are highly preventable. They are highly prevalent in some countries of Southern Europe, but the incidence is increasing almost daily in the non-prevalent regions of Europe. From the epidemiological databases of our organization, we find that there are at least 27,000 patients with beta thalassemia syndromes and at least 45,000 sickle cell patients currently known in Europe. These numbers are likely to be underestimates in the absence of registries in most countries. There are well-documented strategies which can address both the prevention and the management of these disorders. And birth defects are in general underestimated. We consider that there are more than 5,000 rare diseases listed, most of which are congenital and chronic, and which may affect 6 to 8% of the population, even if each disorder is rare. It is the position of our organization that the hemoglobin disorders, as well as many other chronic disorders, require special attention and separate policies from the major non-communicable diseases which are so far promoted by the WHO. We propose that a major section is initiated for these diseases in order to establish strategies and policies suitable for countries of the WHO region. Thank you.